Welcome everybody to the BCP Council Health and Wellbeing Board. I'm Councillor David Brown, as most of you will know me, the portfolio holder for Health and Wellbeing at BCP Council and the chair of the Health and Wellbeing Board. Firstly, I'd just ask our Democratic Services Officer to read the housekeeping notice.
Thank you, Chair. Please note that this meeting is being broadcast by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chair in case of disruption. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point at the War Memorial in the gardens opposite the front of this building. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. For those in the room, that includes turning off microphones when not speaking and turning the volume down completely on your laptops. Thank you.
Thanks for that. Just reminds me to turn the volume down on my laptop so it doesn't disturb us. Right, I'll now move on to the agenda items for the meeting, starting with apologies and substitutes. I will go round after that just to do introductions because we always tend to have a few sort of new faces or to make sure everybody knows who everybody is in the room. So firstly, apologies.
We've received apologies from Councillor Sandra Moore, Sam Crowe, Patricia Miller, Heather Dixie, Siobhan Harrington and Richard Renault.
Thank you. And do we have any substitute members?
Yeah, Rachel Partridge is substituting for Sam Crowe today. Sarah Herbert is substituting for Siobhan Harrington, and Lizzie Warrington is subbing for Richard Renault.
Okay, great. I will at that point, yeah, because there's a couple of names I'm not familiar with, so I will go round and just do introductions. As I say, I'm Councillor David Brown, the chair of the Health and Wellbeing Board. We've got Louise as our Democratic Support Officer, clerk in today's meeting.
Hi everyone, Gillian Kay, Corporate Director for Wellbeing in BCP Council.
Hello, Councillor Richard Burton. I've got the Children's and Young People's portfolio.
Good afternoon, Rachel Partridge, Acting Director of Public Health.
Good afternoon, Mark Harris, Deputy Director of Place within NHS Dorset.
Good afternoon all, I'm Brad Stevens from Dorset and Wiltshire Fire and Rescue.
Hi everyone, I'm Amy Collins from Community Action Network.
Hello, Lizzie Warrington on behalf of Richard Renault at University Hospitals Dorset.
Hi, Sarah Herbert, Chief Nursing Officer at UHD.
Scott Saffin, Better Care Fund Manager, BCP Council.
Afternoon, Zina Dighton, Interim Director of Commissioning, BCP Council.
Good afternoon, everybody. Cathy Hadley, Corporate Director of Children's Services, BCP.
Good afternoon, Betty Butlin, Director of Adult Social Care in BCP Council.
Great, thank you. Hopefully that's helpful because, yeah, certainly there's a few new faces to know. Okay, need to confirm the minutes of the last two meetings on the 21st of October and the 13th of January, which have been circulated. I have copies here. Did anybody have any queries or questions or amendments for the minutes of the last two meetings? Does everybody consent that I sign those as an accurate record of the meetings? Looks like people are nodding. Okay, I will do that. Thank you very much. So, agenda item 4, declarations of interest. Any interest to be declared? No, looks like there aren't any. If anything arises during the meeting that you suddenly realise you've got a declarable interest or even a personal interest, then please let me know and I'm happy to take that during the meeting. Public issues. So are there any public issues for this meeting?
There are no public issues, Chair.
Okay, thank you. So we can get on to the main items of business. So first, I think this one was carried over from the previous meeting, actually, Community Action Network. So Amy from Community Action Network, if you're okay to present?
Of course, thank you. Hi everyone, so I am from Community Action Network. We are a local infrastructure charity that supports the voluntary and community sector across Bournemouth, Christchurch, Poole and Dorset area. So we are a charity set up to support the local voluntary community sector. So within Dorset, the annual contribution of volunteers is around £700 million per year. So that's how much the value of volunteers and trustees bring into the local area. And that's across around nearly 7,000 registered charities and community groups. So there's everything from the small grassroots charities through to the national charities that are operating in Dorset. So we are set up to serve and champion that voluntary and community sector. And we do that because we are a membership-led body and we've got around 800 members that we work with, predominantly voluntary and community sector groups. However, we also have a great range of statutory partners as well within that. We are a registered charity, so we are led by a board of trustees that provide accountability to the sector. So our purpose is to strengthen VCS organisations to help deliver high quality services sustainably. So we do that through supporting people to set up their own charities, community groups. We give advice around governance, good practice, funding advice to help those charities and community groups thrive. So many of the people that we support rely on the charities, and we're there to make sure the charities are operating correctly and sustainably. Alongside that, we offer a lot of training to frontline groups, so around writing business plans, policies and processes, choosing your legal structure. The other pillar is about increasing volunteer engagement. We work extensively to ensure charities have a really robust volunteer programme in place and that they have volunteers to enable them to deliver the services that they provide. More and more of the charities are having pressure on their services and volunteers are helping to support that and fill in the gaps. The next sort of pillar is about enhancing collaboration. So we work to bring charities, community groups and statutory partners together. We do that through our networks, through our representation on boards as well. We promote equity, diversity, inclusion. So we have our ethnically diverse communities team and they work to support EDC groups with funding, with that good practice advice, networking, opportunity to share good practice. And then we help strengthen VCS infrastructure through our member-led membership. So by being a voice for the member, but we're a voice for the voluntary and community sector by listening to our members and taking on board what they're currently going through. And then our last pillar is about being a strong and successful charity. And we do that through our board of trustees, through our annual reports, through our KPIs. So that's just a little bit about what we do. So here's some key figures of what we've achieved in 2024. So we supported 55 new groups to set up. So that's people coming to us with an initial idea and we see them through to getting charity status on that one. We supported 400 groups from within the voluntary and community sector. They accessed our advice and support. Over 390 groups attended our training and webinars. And again, that's all very much around supporting those voluntary and community sector groups to be sustainable, strong and operating with good practice. We supported over 700 people to volunteer, and that was achieved through our outreach, through our volunteer database and through providing one-to-one advice and support to people looking to volunteer. We also run a range of networking sessions based on either themes or geographical areas, and over 300 groups attended those last year. So that just gives a flavour of how much we work with the voluntary and community sector within BCP in Dorset. We also lead on a number of projects, so as well as our good practice, our volunteering hub, our BCP Council projects include our early help partnership. So we've been working with family hubs, linking them into the voluntary and community sector, ensuring the charities that work with children, young people and families have the policies, the volunteers that they need. Like I mentioned earlier, we've got our ethnically diverse communities project, which was launched last year. We've just had our first group successfully achieve funding to help them to run more projects further down the line. We have our Trusted Reviewers project, so that's very much working with people with additional support needs to understand what they actually want from their daycare opportunities. And then we also have our Wellbeing Collaborative as well, which is very much around supporting people on discharge from hospital to help them come out of hospital as early as possible. And that often is in the form of small grants to help provide furniture, a deep clean, so then they can get back home as soon as possible. We also have our Access Wellbeing project, which is just won an award. It's a database of all the community services available that professionals can link in with, so they can identify opportunities for the people they work with. And then we've got our Access to Community Support Services project as well. So there's a lot of work that we do within CAN. As part of our work, every year we run a State of the Sector report. Obviously, we're there to be the voice of the sector, and so we send out this survey to establish what actually is happening within the voluntary and community sector landscape. Within that, the majority of charities, community groups that operate focus on mental health and wellbeing, advice and information, and community services. So that's sort of primary services. And then the main people accessing those are older people, disabled people, and people experiencing mental health issues. So the voluntary community sector is very much there to support those individuals. So that State of the Sector report very much highlights the sort of key challenges within the voluntary and community sector at the moment is around the recruitment and retention of staff and volunteers, especially with the changes to national insurance. Some charities can no longer afford that increase, and we're finding there's some cuts to services within those charities. There's much higher demand within charities. We're finding a lot of the charities such as Age UK, Diverse Abilities have quite long waiting lists for their services. The voluntary and community sector groups highlighted that there could be better relationships with public sector organisations, and that could be around communication, around funding, around representation. It's also a challenging financial landscape, so I'm sure you'll all be very aware. For the groups that we work with, we're noticing more and more there's a very much increased demand in their services, but there's decreasing funding with often very short-term funding contracts in place. The sort of main gaps in service provision within the voluntary and community sector is around social isolation. We're seeing that more and more with individuals needing support to link in with community activities. There's gaps in mental health support, again, often with long waiting lists. And the last one is around accessible transport. So although there might be activities people can get to and attend, but actually how do they get there? How do they get to those GP appointments? So that's the sort of main challenges at the moment. So the recommendations, so what we're working on with our partners, with our statutory partners, is about looking at enhanced funding flexibility, so helping charities, community groups to apply for funding. There needs to be a focus on financial resilience, so enabling charities to apply for longer term funding. Addressing staffing and volunteer challenges, so how can we support them with that? It's about strengthening relationships across the system as well, ensuring that there is good partnership working between the voluntary and community sector and the statutory partners. It's about looking at the key service gaps as well and targeting those. And lastly, it's very much around collaborating and sharing of best practice. So that's a little bit about the recommendations there. And then on the last one, it just shows some of the charities that we work with in community groups. I'm sure some of you have heard of a lot of those. And it just shows the breadth of who we work with, from SEDCAT, the community transport, to Reeve, the group of asylum seekers who've set up their own volunteering project within Bournemouth. And that just gives you a little flavour of just a small handful of the groups that we work with. So any questions at all about what we do or anything?
Yeah, thanks for that, Amy. That's a useful sort of just summary and background to what you do. Anybody want to comment at all? Gillian, did you want to?
I'm going to move my microphone if I can, so that I can look into the room instead of away from it. Thank you. That was such a useful summary of the sector and CAN's role in it and the state of things in BCP. We have such a wealth of of resource, don't we, as in our voluntary and community sector? The numbers of community and voluntary organisations that we have in such a small place, it's such an asset for us. And something we should really celebrate. But I think what your report also reminds us of is that's not something we can take for granted, and its sustainability isn't something we can take for granted. My question was around the point on relationships with public sector organisations could be better, because that's something that I think as partners on the Health and Wellbeing Board we should reflect on. So I wonder if you can say any more about that, and if there's anything that if you've got an ask of partners in the room about how we could strengthen those relationships with you and with the sector too. Thank you.
Thank you. So I think one of the main issues is that there is that increased demand expecting voluntary community sector groups to offer services, but yet the funding and the recognition of the work that they do isn't recognised. And I think for a lot of charities, ourselves included, it's very much around looking at the sustainable funding, so they can plan not just for the next 12 months, but next 3 years, next 5 years. And I think having that security and that sustainability would make a big difference. I think it's also around decision making, make sure all the voluntary and community sector groups are on board with what decisions are taking place, and that they're kept up to date with any changes that are taking place, such as within the ICB as well.
Betty, do you want to?
Hi. Thank you for that. That was really helpful. And just to echo some of what Gillian said, I just have a few points. I don't know if you'll be able to answer them, but just points that I'm interested in. So first of all, really acknowledge the demand's gone up, and that's something that we're seeing as well, and really kind of needing to kind of work closely with our voluntary and community sector partners. So really keen to kind of understand your demand as well, maybe outside of here. And then just some of the areas where you've identified that there's a gap in those provisions, and I'm interested in all of them, but one that kind of jumped out at me was the social isolation and the gap. There is a gap, or the gap might be growing more in that area, and we all know that social isolation then brings lots of other things that are attributed because of that, and we want to be able to kind of reach those people and be able to support and work with them where this is the case. And I just wondered, you mentioned about targeting those areas as one of your recommendations, targeting the areas where you have a gap, and that being one of those. When you say target those, what does that mean? Does that mean you have a plan for those areas that you know there is a gap, and that you've got strategy to how to maybe target those areas specifically? Thanks.
Thank you. So with regards to that, I think the main thing that we're doing with that report is highlighting to funders that there are the gaps there. But it's also about supporting those charities that provide those services to recruit more volunteers, to ensure they are sustainable, that they have the right policies and practices in place. And it's about signposting as well. So it's ensuring the people that are vulnerable are aware of what is out there as well.
Kathy, do you want to?
Thank you very much for that presentation. It was really good outline of the services that can support and manage in the charities. And I, like Betty, are interested in terms of that demand and that increase in demand, because obviously that's something we see in children's services. And I think collectively we could look at what that demand is and what does that tell us about our strategic intent going forward collectively. I think your point about being informed and being kept informed, I think is well made. Just thinking in terms of that, the spaces and the government direction and strategies currently are changing very quickly and have been driven quite fast, especially in terms of children. And so it was a useful reminder of how we open up that conversation, one, to inform, but two, to look and think about opportunities that we could work towards collectively, and whether that produces some financial sustainability, but I'm also conscious that sometimes, even from a local authority's point of view, we're at the behest of the DfE. And so I know we've had some conversations about around that early help and things coming to an end. And of course, we're not sure whether some of the funding is coming from the DfE for us to then continue it. And so it is a real challenge, but that's not a reason for us not to think about that and or make representation. So thank you very much for the presentation.
Thank you.
Richard, did you want to?
Yeah. So very thank you for that presentation. It was really interesting. And I'm a trustee of a charity which has links or you support with On Waste.
Yeah, we know.
We at the we at the event this week.
Fantastic.
One thing that we're feeling, in the sort of in the voluntary sector, is that there's less and less people prepared to volunteer. Now that's just our feeling. I don't know whether it's just because we see things from our own perspective. I'm talking about when we do things as councillors as well. It's more difficult to get people to volunteer. Do you actually hold any data on the number of people who volunteer, and have you noticed the same issue?
Yeah, it is a national picture about the number of volunteers dropping. NCVO have done quite a lot of research into that, and I think it's there's a multitude of reasons. It's a lot of it's to do with cost of living, people taking on second jobs, providing childcare, wanting to enjoy life after COVID. There's so many different reasons why, and part of our role is to work with charities to look at ways we could make the roles more flexible. Could we adapt them so they could be done remotely as well? So we're trying to look at new ways of bringing in volunteers. Because I think Win on Waste certainly isn't an anomaly in that aspect. I think it's a bigger problem, unfortunately, at the moment.
Rachel, did you want to?
Hello, good afternoon. Really great, and it feels like the presentation sets the context for a lot of the work of the Health and Wellbeing Board, and also sort of later on in the agenda around how we're moving on the strategy, and just recognising the really valuable and important role that the volunteering community sector play. And just so wanted to take the opportunity whilst I can to say it was really, really valuable, and it's great to bring it to life as well in terms of supporting the sector and the structure, and just recognising linking in as part of the developing of the volunteering community sector assembly and that role, that really important mechanism by which we're trying to really make much more robust and the interface, and so we try and get that much more coordinated and engaged way. So both using your strengths and the sector's strengths, hearing from our communities and understanding the feedback from communities, as well as accessing and supporting services that are delivered. So really important. So I just wanted to add to the fulsome praise, but recognising it's an important part of our jigsaw piece when it comes to health and wellbeing. So just thank you.
Thank you.
Any other comments or questions at all for Amy or any from our online colleagues? Oh, Kat, did you want to go?
Thank you. Apologies if it was mentioned before I came on the call. Thank you, Amy. Always really, really good to hear about the work that CAN are doing. The support that organisations like CAN provide to the community and voluntary sector is invaluable. And I'll give you an example. We've got over 1,500 volunteers just in BCP Council alone that support BCP Council services, whether that's within our museums, our libraries, our adult social care, our children's services. It's an incredible amount of volunteers. And when you think about what that is when it's scaled up across Bournemouth, Christchurch and Poole, it's a significant number. We recently held a thank you event for volunteers that have volunteered for over 10 years within BCP Council. We had 64 volunteers that attended that event that have been volunteering over 10 years. That equated to over 1,000 years worth of support that they have provided between them in terms of supporting BCP Council services. We cannot do this without volunteers and the community and voluntary sector. So I just want to sing the praises of CAN, and thank you very much for the work that you do for our communities in Bournemouth, Christchurch and Poole.
Thank you.
Thank you for that, Kat. I think everybody would support that. Any other points or comments? I've got my own reflections. I just wanted to comment myself. I suppose in some ways we can look at, can the voluntary sector come to our health and wellbeing board meeting, and some of the items you talked about relate directly obviously to health and wellbeing, but from my view, the voluntary sector, it's not just the narrow bit that relates to health and wellbeing, but it's actually the entire voluntary sector supports health and wellbeing. It's not just, I don't know, those that you talk about, mental health support or social isolation or those sorts of things. It's actually everything that the sector does, and certainly my experience of CAN, or the forerunners of Bournemouth Council Voluntary Services and Poole Council Voluntary Service over the years. I've been a trustee of 3 charities locally, and I think you sort of run through some of the bits about supporting the local sector, but I think that's really only a couple of bullet points, but it's so valuable to those groups. Certainly I've been involved where we've taken over a failing organisation, established a new charity. We had funding from CAN or Poole Council Voluntary Services to negotiate a new lease on properties. Grant funding bids. I know you sort of help a lot of organisations with grant funding bids and with governance structures and trustee training and all of that. So I think it's so broad, certainly in my experience, that we wouldn't be able to have anything like the voluntary sector we've got locally without that sort of institutional support, really, to actually make sure that people are doing the best they can in those roles. So thank you for that. My just comment was about partnership working, because I guess there's a lot of sort of informal partnership working, with the council officers, but there's the more sort of formal partnership working where you're actually carrying out work sort of on behalf of the council, like the trusted reviewers you mentioned around the sort of day opportunities. I don't know how that's sort of going in terms of the progress that the trusted reviewers are making. I don't know if you can comment at all on the direct work you're doing with the council.
Yeah, so the Trusted Reviewers project, I believe, is going very well at the moment. So the team is working with a number of individuals, supporting them to access volunteering opportunities, new activities, and the people they're supporting are absolutely loving that opportunity to get out and about and doing something other than the usual sort of day centre. So they're making really good progress with that. They held a really successful event end of February, where they brought carers and the people they support together with lots of community activities, community providers, so they can see what else is happening within the local area. And I think that was really, really successful as well. Just that chance to find out what's happening within the area.
Yeah. I think from a health and wellbeing board point of view, it's both of those things. The fact that you're there for the whole sector right across the 3 towns supporting it, but then it's those specific schemes that you've got which actually sort of directly influence the sort of work that's going on within the council in our health and care work. So thank you for that. Any other comments or questions? If there's not, then thank you very much, Amy, for coming along and updating us and briefing us, and hopefully you've sort of taken on board the sort of the comments that have been fed back. Thank you.
Yeah, thank you.
Okay. Right, we've got agenda items 7 and 8 are both around Better Care Fund. So item 7, Better Care Fund, which is the current year 24-25 Q3 report, which has been circulated. Scott, I know you're online to give us our sort of regular update on where we are with the Better Care Fund. So if you can go ahead.
Are you right, Chair, if I just introduce it and then I'll hand over to Scott?
Yeah, actually, there's Lena.
Yeah, so we're jointly presenting, and we've had colleagues, we've got Emma online, Emma Wilson from NHS Dorset, the Better Care Fund Q3, and a draft, which is a working document for the BCF plan 25-26. The reason the plan is in draft is because we've historically previously had to retrospectively come with for approval from the Health and Wellbeing Board for the quarterly reports and the annual plan. And we're trying to get ahead of that. So we are trying to move to the best practice, synchronise with the Health and Wellbeing Board meetings, so they're prior to the submission dates for the Better Care Fund, Better Care Fund England. So we get approval before we submit. So if I'll hand over to Scott, who's got a short presentation around that and a bit more detail.
Good afternoon, everyone. Just wanted to give you a short presentation today about the Better Care Fund. So just give a summary of the Q3 report and also show plans of what we've got coming for 25-26. So we just wanted to give a short presentation, bring the report to life a little bit, and we can see how things will go. So let's go to the next slide. So I'll start with the next few slides, focusing on Q3, which we submitted to Better Care England on the 14th of February. And with this, it just provided details into the expenditure of the schemes, the capacity and demand plans that were supplied by NHS Dorset, along with the performances of the metrics that we have touched upon in previous meetings. So I was going on to the next one. So I'll touch upon the metrics first. So sort of to show what's on track to meet target for 24-25, we've got the avoidable admissions, discharge to usual place of residence, and the residential care admissions. Those are on track. Whereas we've got hospitalisations linked to falls, they are still higher than forecasted. But we are hoping with the work from the Future Care programme that there will be initiatives in place that will reduce emergency admissions, and these will see positive results within that metric. And with the expenditure as of 31st of December 2024, expenditure is on track. We have approximately spent about 74% of the income. And in January 2025, there was additional funding provided to the Disabled Facilities Grant. So this should be able to provide an extra 45 housing adaptations for 24-25 as well. And then for capacity and demand, so we gave an update. This is related to mostly the intermediate care offerings. So usually following hospital discharge, or some are step up from the community as well. So that includes support from CANS and our voluntary sector partners. So our demand and capacity are broadly in line with the plans put in place earlier in 2024, but we have experienced peaks in demand that have impacted system flow in the third quarter. And those pressures have remained going into 2025. And we had high demand also in the voluntary sector, so they experienced higher than we were anticipating, but it seemed to have been handled quite nicely. So thank you for that. And we also had the urgency community response, which saw roughly about 800 monthly referrals during Q3. And these services all help provide the help necessary to avoid hospitalisation. So that was Q3, and then I just want to touch. So we are just about to submit for the Better Care Fund 2025 and 26. So on the 31st of January, a policy framework was published by the government setting out what they would want to see each health and wellbeing board for the Better Care Fund. So this included submitting a planning template, a narrative, as well as a capacity and demand plan. And with this policy framework, the expenditure for the minimum contributions for the local authorities and NHS were set alongside with that. So for the local authority Better Care grant, no uplift from 2024 to 25 was given. So it remains at £16.6 million for the year. And the minimum NHS contribution received a 1.7% uplift from 24-25. But it was also directed that within that, there has to be a 9% uplift that goes towards adult social care services. And then there'll be a narrative which will set out the priorities for the system used in the Better Care Fund. So what we've stated out is aligning our services towards a home first agenda, the implementation of the transfer of care hubs across Dorset, reviewing our hospital discharge pathways, and reducing reliance on legacy long-term care services such as residential care. And these are some of our ambitions with the metrics. So they had been slightly revised since 24-25. So avoidable admissions and the falls have sort of all been linked into emergency admissions overall. So NHS also have set an ambition of a 1.05% reduction compared to 24-25. This is including the seasonal variations that we usually see, especially in the winter, but we also calculated some of the benefits that the Future Care programme is hoping to achieve. And then with discharge delays, which is a new metric. So this is judging like how far from the discharge ready date do we actually discharge people from hospital. So we've put about a 0.99 day average of how long, how different the delays, where 2024 had a 1.07 day in discharge delays. So once again, this is linked to the future care programme, which is going to look into the pathways. And then residential admissions, we are looking for roughly about 429 new admissions into our long-term residential care homes. So this is still seeing that there are challenges in adult social care. We've got economic pressures that will most likely still persist from 24-25, but we have initiatives in place to promote independence, and we will have home care packages as well. So we've got the BCP Council's transformation programme, which we're hoping will help with that, as well as the additional uplift from the Disabled Facilities Grant and continued use of home care packages to reduce that reliance on residential care and support sustainable processes. And then just looking ahead, so further on from this, so we will have the 24-25 end of year report that's going to be presented at the next Health and Wellbeing Board, so that'll give a comprehensive overview of what's been done over the last 12 months with the Better Care Fund. Recently, the Better Care Fund England have published a dashboard that allows us to have greater insight into what is going on, so we can compare expenditure and metrics to regional benchmarks and national as well. And then we will continue working within the integrated care system to monitor the schemes within the BCF, as well as when the future care programme develops as well. Thank you.
Thank you, Scott. That's a comprehensive report, and I know all the sort of the detailed tables are obviously within the report that's been circulated. Any questions or comments or queries from anybody? Betty, did you want to?
Thank you, Scott. This is not an easy presentation to pull together, so thank you very much for your work and other colleagues' work on that. I just wanted to pick up a couple of things. One of the things I wanted to pick up, first of all, was around the future care programme, because you've mentioned that a few times. And just for people who may not know, the Dorset system, health social care system, and with our voluntary community partners, with everyone right across the footprint of Dorset as a county, we have a future care programme set for the next few years, which is very much around enabling a much more focus on independence and recovery, and people being able to go to an environment that is best suited to them. So there's a lot of work going on within that, and we have Newton Europe are involved in the future care programme with us, and that's still relatively in its infancy, but doing some really good work. So it is important to always have that in your minds whenever we're thinking about other things that are going on. I just wanted to pick up two other things, Scott, as well. Just around the sickness to prevention and the change, and it is important to really acknowledge that is a change in the framework, and we will be able to evidence that, but it is important to just labour that point just a little bit there, and also of course the uplift, the minimum uplift of 1.7%. We expect it more, to say the least, but we are where we are from a national perspective. So there will be some challenges around what we currently have and are funding within the BCF, but as a collective group of partners, we will work that through. And just finally for me, on the DFG, additional funding that came through 2 months ago or thereabouts in January, and that will allow to enhance the capacity for those families and those individuals that need disability facilities grants, and I think we calculated it at around 45 additional or thereabouts, give or take a little bit. I'm just really keen that we try to do this within a reasonable timeline, because we know historically not just just not for BCP Council. It's a national thing that the waits for DFG, for most of the time really valid reasons, can be lengthy. And we do have this additional amount of money. We never have enough, but we have a bit of additional money. Really keen to see how we can work collectively, and we do work very closely adult social care and OTs with our housing colleagues and our architects and everybody around that. But just wanted to cite that good news, just emphasise it a bit more. But let's try and get it done in a really timely way, and that's a commitment that will be needed from all of us. Thank you, Chair.
Thank you. Actually, if it's all right, I was just going to come in on that because the comment I was going to give was about the DFG and the additional funding. So, and my understanding, correct me if I'm wrong, is there's some additional in-year funding for disabled facilities grant work this financial year, as well as for next year and sort of ongoing. The funding for this year, because I'm aware of there can be sort of lead times and difficulties getting the right sort of people in place to sort of carry out the works. So the additional funding for this year, does it have to be sort of done and spent by the end of the financial year, or is it as long as the sort of projects are identified this year, then the funding can flow over into the next financial year? Because I know when it was announced, it was like, how on earth are we going to do that before the end of the financial year? We're going to have people working overtime left, right and centre. But yeah, if you can just comment a bit on that.
What you said is exactly right. As long as there's been projects identified before that 31st of March, then it doesn't have to all be spent and done by that date, as long as there's something planned ahead.
Yeah. Great. Thank you for that clarification. Yeah, because that was my worry, because the guys doing the work were going to be rushed right up until the last day of the last day of the financial year. Okay. Any other comments or questions, Gillian?
Can I say a thank you to Scott and to Zena and to Emma and others for bringing this report to us. And I think the point Zena made at the beginning about the Health and Wellbeing Board's role as the governance for the BCF is a really important one. I think it is the right practice to bring the report to us ahead of time and not retrospectively, so that the board can really feel that it has oversight of this funding and how it's deployed. So I know it's been a real rush to do that, following on from the new government guidance coming out. But thank you for bringing it, and I know that you'll work really hard over the next period to finalise it and put the plan into place. I think coming at the end of the year with the end of year report, I think is a really worthwhile opportunity for the board to have some visibility of what's been achieved. So I'd encourage you to bring it back, not just with the numbers, but with some stories from the different projects and the impacts that they're having, so that the board can have some visibility of that and celebrate some of the successes and learn a bit about what you've been doing and what we've been doing across the system with this resource. And then my final point is a really specific one. On the Q3 report, you mentioned the one metric where we are out of line on performance was about hospitalisations following falls, but where we're hoping that some of the work we're doing on future care might address that. And I wondered if you could, it might be unfair, Scott, it's quite a detailed point. I don't know if you can say any more about that, or Zena or Betty, if you want to say more about how we can address that, because that's a really critical area, isn't it? First of all, getting more into prevention in falls, and then making sure that following on from falls, the situation doesn't escalate for people. So thank you.
I'm wondering if Emma is able to help with that question.
Yes, if that's okay. Thank you. Good afternoon, everybody. So from a falls perspective, there are a few initiatives, and what Future Care can do is enhance those initiatives as well. So one that was already mentioned is the urgent care response within 2 hours. So that also supports individuals to stay in their own home, but also to get the care that is required. Equally to that, if somebody does come into hospital with a fall, then we're looking at same-day emergency care. Now, we know if you stay in hospital too long, then you could deteriorate. So it's better to get that person rehabilitated and back into their environment, which they know. So same day emergency care is equally as good for that. But future care is looking at admission avoidance. So that is one of the work streams coming out of it. So hopefully there will be more programmes. What I can do in the end of year report though is focus more on that, of how it's helping people with falls, if that's okay. Thank you, Chair.
Yeah, thank you for that. That's a useful addition. Yes.
May I add a little bit of depth as well? There's a Dorset-wide Ageing Well network that has reformed this year, and Amy Gallagher and Heather Olive, who are part of BCP. Amy was here presenting on ageing communities at the end of last year. They're very much involved, and there is a satellite group that is reformed under Tess Green, who's at NHS Dorset. Heather, Amy and I have been and others have been bombarding her with the work that was done back to 2019, where we came up with a plan. So I feel like there's lots of different strands that are all going on. How we actually make a difference, I'm hopeful that we're going to get there, but I'm not sure at the moment how that plan's actually going to happen. Everyone's very focused on it. The DICE team, which is NHS Dorset Information Portal, has actually overlaid their falls activity with the cost per area, which is part of the story, but only part of the story because not all the falls will end up in a hospital setting. So there is a lot of work going on in this area, but they do seem all to be connected, but still a little bit in silos as well.
Betty,
So I think what Lizzie's just said is a really good example of where there's lots of different things in relation to falls and falls prevention and falls management and maintenance that is happening within the Dorset area, but it's connecting those and making sure that we're getting the best value from them. We know that historically within Dorset we have had a higher proportion of falls. Some of that's to do with our demographic. Well, a lot of it's probably to do with our demographic, but one of the things that we've not been so good on is how we reduce that through education and through prevention and preventative measures. So I think there is absolutely a big focus, and Rachel might want to come in just around some of the public health work that's been going on as well, to kind of look at that in the round and connecting that with other areas. I do think that it is something, and Em's just said that some of this, Emma, you've just touched on some of it. It is an area that we're aware of. It is an area that we know we need to further improve in. We have improved over the years, but not to the level that we would like. So it is a significant area, because we know that when somebody has a fall and the consequences of that fall then go on to much greater things and end up, people have situations that are going to then follow them through for the rest of their lives. And that's something that we're working really hard to try to reduce. But I think there is that, connecting the dots with all of this, and all of it's been really sided on everything that's going on, and then the value of each of those areas and what they're bringing, and then highlighting the gaps within it. Certainly an area that we're interested in within adult care, because of all of the benefits of being preventative in this area. Because if you're not, it's not, individuals don't have the same quality of life, and service provisions are then needed to go and support individuals and their families. And we do know that the higher the age, that this is a higher age group of individuals as well, that a lot of whom will have multiple diagnoses as well. And it's a real area that you can bring huge benefits if you get in there early enough. Thank you, Chair.
any additional comments, particularly on that falls point? Or we got Dawn? Yes.
Hello, colleagues. I hope you can hear me. It was just to say this has been an area of focus for Dorset Healthcare over the last year. It's been one of our quality priorities, and we've rolled that forward as a quality priority for the coming year as well. So I think you've got an awful lot of buy-in from everybody across the system that this is something that we absolutely need to focus on to reduce sort of morbidity and mortality in people that fall at home. So just sort of lend my support to this work stream.
Rachel, did you want to come as well? Thank you, Dawn. Thank you.
Thank you. And I wasn't going to pick specifically necessarily falls, but just to recognise that the Better Care Fund coming to the Health and Wellbeing Board is a really vital and important part of the work of the Health and Wellbeing Board. So recognising that it's a fearsome template that you have to fill in. But just in terms of the spirit of bringing it to life, it's such a critical part of that interface with local authority and healthcare work, that actually taking the opportunity at the next board in terms of the end of year report to bring that to life and recognising some of the important roles that's been acknowledged around the voluntary and community sector, but also that shift to early intervention and prevention, maybe using falls because of this discussion as one of those worked case studies, just to bring it to life so that board members, we see these reports at every health and wellbeing board, but just to have that opportunity to really hear and kind of get that sense of the really important work that goes on out in our communities and across our health and care system. It just feels like a great opportunity to showcase the work that goes on. So just to reiterate that, the support for bringing some case studies and worked examples.
Thank you for that, Rachel. I was just going to on the didn't want to lose the point about the falls and about the different schemes and initiatives that are going on. Are we satisfied that there is enough coordination between all of those, that, or is it? And Lizzie, you seem to indicate that lots of different parts of the sort of health and care structures across Dorset are doing work in this area, but Sarah, did you want to?
I think it's really interesting when actually Lizzie and I were talking about not exactly this piece, but actually about how we do more joined up working across the system. There's so much will and wanting to do the right thing at the moment with the future care. Dawn and I are doing some work on integrated working across even in health, etc. But actually us doing work in integrating health, actually we're missing our huge partner there, which is our BCP, but then that steps into kind of the future care. So I think in some respects there is a bit of stepping back and trying to ascertain the broader picture of everything that's going on, because otherwise there's a real danger of replication and duplication in a lot of the things we're trying to do at the moment, which is great because there's an appetite and there's a real commitment to it. But I am a bit worried that we could be all trying to achieve the same thing but in slightly different ways, as opposed to collaborating more and using the weight of all of our efforts more effectively, if that makes sense.
Just to thinking from our perspective, how do we need to go about that sort of improved coordination and collaboration, and the various governance structures across sort of health and care across Dorset? I mean, is that something that the Integrated Care Board need to sort of actually grapple with, or that needs to be Integrated Care Partnership working? I'm trying to think which sort of governance forum or what route we need to go to actually think about that collaboration and making it better. So, Betty.
So I know Emma will want to come in on this, but I would suggest, just off the top of my head, that it's probably for the Urgent Emergency Care Board to pick this kind of thing up and then decide if it needs to go anywhere else for further governance. But the UEC, Urgent Emergency Care Board, seems to me to be the most prudent place to bring it, really.
Yeah.
Emma's got her hand up, David.
Yeah, Emma, did you want to?
But I was just about to agree with Betty. I think the urgent and emergency care delivery group is one of the forums, but also because we work as systems anyway, there's probably lots of different ones that we can try to bring together. I think there's something about mapping everything. There was a big piece of work done regarding falls a while ago that actually started connecting everything, and it shows that everybody's trying their utmost to do what they can in their particular area, but it's how we can bring it together. I also do think that the Future Care Programme has an opportunity in this, especially in the admission avoidance part. So I think that also would support that. But I'll let Dawn come in to say some more about that.
Thank you, Emma. So falls was identified last year as a system priority for NHS Dorset, and there has been a system piece of work looking through a patient safety sort of improvement lens using the PISA framework, which is the new way that we're trying to deal with incidents to sort of take the learning and move that forward. So I think as we come to the end of this financial year, there should be a conversation back with the NHS Dorset as the sort of, the sort of coordinator, as you like, within the system, and with local authority and with VCSE to see what we do for the year ahead. Because I agree, there's so much going on, and it would make such a huge difference if we could improve the outcomes for our population. So I'm really happy to have a conversation with Pam O'Shea from the ICB and just see where we are.
Yep, thanks for that, Dawn. I've got Mark from NHS Dorset indicating, so yeah, Mike.
No, thanks. I suppose just sitting here listening, I suppose it sounds to me that we've got lots of work going on, some great work, and I suppose it's just thinking about the next item that's on the agenda really, and thinking about the role of this board. Actually, there's the development of a place-based partnership is potentially a really good forum for us to think about where you bring that overall coordination together, because this is not an uncommon thing, is it, that we hear where we've got tons and tons of work going on, but often in silos, and we're not fully, it's not fully sort of seen or sort of visible across each and every one of our partners. So I suppose it's just to put it out there really as something to consider as we move forward and develop that partnership.
Okay, no, that's useful. I'm just wondering, actually, whether we pick that up as recommendations on our next agenda item. We try and sort of formulate a recommendation there to think about that coordination. So, okay, thank you for that discussion. Actually, I think that's quite a valuable conversation discussion. Any other questions or points either on that or on the Better Care Fund report that Scott's presented? I did actually. I had a financial question actually. I always like to try and really understand the money, and there's a lot of money in the Better Care Fund, doing a lot of good work through so many different schemes. You mentioned in your presentation about the funding for next year, and was it the sort of local authority funding is 16.6 million, I think it was, wasn't it? And the NHS is getting without an uplift for next year, but the NHS funding is getting 1.7% uplift. I wanted to try and understand that in relation to where we've got the financial implications in the report in front of us, which breaks it, the sort of top level breaks it down by the different sources of funding. I was just in my own head trying to equate the 16.6 million with what the lines that we've got on there about what we've got. There's additional local authority funding, local authority discharge funding. Don't know if you're able to enlighten me a bit, just to...
Yeah, I'll try my best. So 16.6 million is in relation to the local authority Better Care grant. So previously that was called the Improved Better Care Fund, and that is money that the local authority chooses to use, whether that be on services like home care, residential care, social workers. So that money usually links to those services. And then the additional, because you mentioned about the additional contribution, that's towards a moving on from hospital living project that's been ongoing for several years, and that just has helped a cohort of people move from hospital into the community, right. And that's what's linked to that bit of funding.
Right. Okay. Okay. So that 16.6 is looking at that Improved Better Care Fund plus the. Is that the local authority discharge funding? Is that what's listed there? Is that all?
So the discharge funding has been sort of consolidated into that local authority Better Care grant.
Right. Yeah. Okay, that helps me try and understand those numbers a a little bit better. So thank you for that. Yeah, and I know this morning we're having a conversation about the that local authority discharge funding as well, and what it's been around for some years, hasn't it? But yeah, and what that's actually doing, the sort of campus funding. So okay, and just on your presentation, you talked then about the NHS funding has got an uplift of 1.7%, but then there was another bit about social care funding. Was it 3.9%? So just wanted to understand.
Yeah,
that
so within the minimum NHS contribution, there has to be a minimum required spend for adult social care services. And that amount, what Department of Health and Social Care have said is that that has to be uplifted by 3.9%. So it's a bit of confusion because within that amount, within that 1.7%, they also want this 3.9% uplift on those social care services.
Right, so social care services but funded by NHS.
Minimum NHS contribution.
Right, okay, good, that helps me understand. Okay, right, any other comments or questions on the Better Care Fund report? The recommendation we have in front of us is that we retrospectively approve the Better Care Fund Q3 report, and we'll come on in a moment to the next item. We're happy to retrospectively approve that Q3 report. Looks like everybody's okay. Yeah, okay, we'll take that as recommended and approved. So we'll move on to then just the item 8, the Better Care Fund 25-26 plan. So you've obviously already touched on that. Yeah, is there anything else you want to present in terms of that, or is that's covered both agenda items, doesn't it, your presentation?
Yeah, that's everything. Thank you, Chair.
Any particular points around the 25-26 plan, other than what's already been commented? Betty?
Yeah, I just think it's important to really note and acknowledge that it's going to be very challenging because of the funding and the challenges with the funding. And as Scott has just alluded to, the minimum uplift as well. So it is going to be challenging, and we will have joint conversations across our health and social care system around that and the impact that is likely to have. So I think it's really important that the board acknowledge that it is going to be different to what we've had. And if my memory serves me right, I think we have about 50 schemes or thereabouts, and we will have to go through those schemes and have a look collectively and jointly, with the council and our NHS colleagues to make those decisions around what the money will lend itself to be able to support. And whether or not there's any fallout from that. So I think it's just important that we're citing that at the board today as well in advance of that.
Okay.
Thank you.
Zena, did you want to?
Yeah, just to acknowledge there is a shortfall in the funding. So over the next couple of weeks with our NHS colleagues, we'll be going through the schemes that we might need to make some really hard decisions about, whether that's decommissioning or actually reducing the funding envelope for those services. But we'll follow due process in doing impact assessments and following a full decommissioning process if that's needed. But we'll be having those conversations over the next few weeks.
Okay, and I suppose that's a difficult bit. We know what the sort of metrics are for the Better Care Fund and what our objectives are. So I suppose it's a case of having to keep those in mind as we go through those schemes about which are really critical to delivering those, and which ones, unfortunately, like you say, it could mean just changing the funding for some of those schemes. It could mean decommissioning a scheme, but yeah, those are going to have to be difficult sort of considerations with the funding we've got for next year. So. Any comments or questions, particularly about the 25-26 Better Care Fund plan? Funding for it. Did we want to? I don't have any sort of specific recommendations there. Just have a look. Are there any particular recommendations we want to note? I know we've had the conversation about the coordination of different work streams across the sort of health and social care sector in Dorset. I don't know if anyone wanted to sort of make a comment or recommendation in terms of that, or whether NHS Dorset wanted to pick up. Mark, I don't know if...
I guess it's probably worthwhile having, I mean, it'll come up in the next agenda item, won't it, around the partnership side of things and the role of a partnership, what that looks like. And I guess what we, you know, not to dip into it too early, but I suppose that's looking at more population size, whereas I suppose some of the other stuff is around individuals. And I guess that's how we need to work out the distinguishing features between, say, what the Better Care Fund is doing on individual cases versus actually some of the falls prevention stuff that we might talk about there as an example. Becomes more of a sort of societal, broader sort of piece of work that we can do. Personally, I feel that, you know, if we can pick it up in the next agenda item around sort of what could be some of those things. People talked about stock take, and that's something that I guess that will be touched on as well in the next item around the workshop that we had around a partnership. So I think it's probably worthwhile just waiting for that conversation. If that's okay. Thanks.
Okay, that's useful. Gillian.
Yeah, just one final point. I'm conscious that the full detailed report did come out quite late because of the sort of timing pressure that we mentioned. I would encourage board members, if you haven't had the opportunity to look at it, to have a look at that narrative template. It isn't just the Excel spreadsheets. There's a narrative that we've been putting together that tells the wider story of change going on in our system, with the Better Care Fund at the heart of it. So it talks about future care. It also talks about the Fulfilled Lives programme that we're taking forward in adult social care. It talks about our approach to health inequalities as well. So there's quite a lot of different threads in there that are worth taking a look at, because it's the start of some of that mapping that we've been talking about and understanding what we're all doing. And I think if there are further detailed comments or things that we've missed from that, there is time outside of the board for members to suggest that we include those. I'm looking across at Scott and Zena on what the timescale is on that. I'm sure it's extremely tight. But just if people do want to bring any detail into it, please do get back to us. You know, quickly this week, I would say. But it's not a long document, and it's an easy one to read. So thank you.
Can I just come back? Yeah, the report has to go through BCF England on 31st of March, because obviously they've released so much for the changes of the templates quite late. Everything's been quite a priority to get through. So obviously that's why it's obviously come now, but obviously with very tight timescales on everything.
Yeah. Okay. Yeah, and I think that's a good point and a really good point, Gillian, that obviously, yeah, the report's just come through today for members to have a look at, and I'm sure not everybody's had a chance to sort of read through everything in it. So it'd be a case of this week, as soon as possible during this week, if people get a chance to. I guess it's even a case of, you know, as you read through the report and the template and the narrative that's there, if you've got any comments to feedback, even around, I don't know, the wording or the content or anything there, then would it be a case of feeding it back to Scott and Zena primarily to give your input to make tweaks or make changes or before submission in 7 days' time? Yeah, so okay, is that okay with everybody to at least spare an hour or two this week to sort of scroll through that report and actually just feed your comments straight into as necessary? So okay, I think on that item that was all we'd really recommendation wasn't it, to ask for any comments on the plan for next year. So any other points to be made on that? Otherwise we will move on to the next agenda item around our strategy. No more comments online. Okay, right, thank you for that. And yeah, if anybody gets a chance to sort of feed in, thank you, Scott, particularly for all your endeavours in trying to make sense of that really sort of complex area, which I know is really critical to what we do as a health and wellbeing board, to make sure you've got our input into those plans. Okay, agenda item 9 next, which is the health and wellbeing strategy to action through the place-based partnerships. So Kat, I know you're online here to present this to us, so over to you. Thank you.
Thank you very much indeed, Chair. Hello, everybody. My name is Kat McMillan. I'm Head of Communities, Partnerships and Community Safety at BCP Council. And I'm here to give you a summary of the progress to date around our work around the place-based partnership, and what we're proposing are the next steps for how we take that forward. So if you bear with me just 1 second, I will load up a presentation. And hopefully that's now loaded up for you. So what we'd like to talk to you today and open a discussion about is about the strategy to action plan. And we're very much, as you'd expect, I'm coming from a communities perspective. So we're about it starting with people, and very much about how we, and I'll get onto this in a bit. You'll probably, those of you who know me will know that my language isn't health language, it's community language, about how we take this forward and make it real in terms of how we improve lives and outcomes for people within Bournemouth, Christchurch and Poole. So what do we know? Well, I think we know our communities quite well. We're really good about joint strategic needs assessment. We've done the State of BCP report, which we update as often as we can. We know our data around indices of multiple deprivation. That will be updated hopefully around September this year. We do deep dives into specific subjects, such as the State of Ageing report that came back to the Health and Wellbeing Board earlier in the year. And we have detailed deep dives as well around the Health Watch reports and other information that's relevant to understanding what our communities are experiencing in Bournemouth, Christchurch and Poole. But where could we do a little bit better? And this is where I want to ask if this is what we want the place-based partnership to actually undertake and to do. So thinking about the voice of lived experience, do we do really well at listening broadly, but also listening deeply? And about our community connections and trusted voices. So the work that you heard from Amy earlier on from Community Action Network about making sure that all of that really valuable qualitative insight and experience is fed into that as well. So we're not just looking at hard data, we're looking at people. And what I've heard so far from the conversations we've had today have been very much around connections, needing to know real stories, needing to collaborate, needing to make sure we're not working in silos. And that's where I think our place-based partnership for Bournemouth, Christchurch and Poole could really bring an added layer to what I refer to as the community cake. So none of this will be unfamiliar to you. We've already agreed that we would adopt the Integrated Care Partnership Strategy, which has the 3 themes you can see there: prevention and early help, thriving communities, and working better together. We're also working towards BCP Council's corporate strategy, and we're also working towards the NHS Joint Forward Plan. And the role of the Health and Wellbeing Board, well, in January, you agreed that the role for the board would be the following. So let's think about identifying topic areas that we can really champion, monitor and drive forwards. It's an opportunity to convene system partners to work collaboratively, to share priorities and make a real difference in relation to health and wellbeing. Really key here, I think, to support the inclusion of health and wellbeing issues in all policies. Consider relevant data and metrics to monitor progress, to make sure we're making a real difference, to focus on working together and co-production, and to sponsor the work of the place-based partnership and champion integration around neighbourhoods. And the survey that was undertaken earlier in the year, in January, it asked you to identify what do you think the key things are that we could focus on as a health and wellbeing board for 2025. And you agreed that you wanted to focus on children and young people, community mental health transformation, supporting adults to live well and independently, housing and cost of living and poverty. And then when we look at what's the role of the place-based partnership which feeds into the Health and Wellbeing Board, and I'm not going to read through this in great detail. It's all within the report that you've had in advance with the papers for the meeting, but I've highlighted for you where I think the key items are. So it's around tackling the wider factors that influence health and drive inequalities, to make sure that we're making more effective use of the combined resources that we have available to us, to address the social and economic factors that influence health and wellbeing, and to add value above and beyond the contributions of individual organisations or entire systems. and to make sure the work that we do complements each other rather than duplicates or replicates, as was mentioned earlier. And a lot of you will have heard me talk about the community cake before. So this is in relation to what do we need in terms of delivering and driving forward, thriving, empowering communities. And it's about having different layers of a cake. So if you think of your, whatever is your particular cake, whether you're a chocolate cake or you're a vanilla sponge cake, you've got your 2 layers of cake and you've got your bit in the middle. And the bottom bit is the statutory stuff. What is it that we as statutory organisations have to do and have to deliver? That's our core function. We have to crack on with that and do it. And at the top layer of that sponge cake is what is the community and voluntary sector doing? How do they support us in doing that? And where I see the role of the place-based partnership is that jam or the Nutella that's in the middle. So you've got your gaps, you know, where things should be done, but we don't have the resources and it's not statutory anymore, so it's not a priority. But how can the place-based partnership help to smooth over those layers of the cake and make us a whole community cake that function better together? So the work to date that's taken place, there was an early meeting in October last year, and most recently a workshop was held in February to help shape an action plan for how we take forward a place-based partnership. And at the workshop, it was agreed that the place-based partnership should add value, not duplicate existing governance, help to shape the forward plan of the Health and Wellbeing Board alongside those statutory functions that I've just mentioned. It should connect the Health and Wellbeing Board to neighbourhoods and communities, and it should support a wellbeing in all policies approach. And it should be about us working together to become a formal partnership which can receive and allocate delegated funding based on the needs of our communities, shaping integrated commissioning strategies and driving forward action. What does it actually mean? And I'll take it right back again to starting with people. We're not looking as a place-based partnership about conditions, issues, numbers, diagnosis. We're talking about individual people and what is it that they need under the Maslow hierarchy of need in order to have a healthy and well-being life. Really strong agreement, as I mentioned earlier, that we shouldn't duplicate existing activity. But do we know, and this has been reflected on earlier in the conversations, do we know what's going on across the system? We're all so busy doing the day job and often working in silos that there's a need for us to come together and have a bit of headspace to do some mapping. Keep it simple. We can overcomplicate things, can't we, by setting up governance arrangements and hierarchical needs, but let's keep it simple. Let's start with a plan on a page and grow from there, and the form and function can follow after that. And every partner needs to be actively engaged outside of meetings. So I'm looking to you to identify who is the lead for your organisation. And it's probably not those of you who are sat around the table. You're here in your strategic role. But who's that middle ground, that sort of between the operational and the strategic, that can get involved and make a real difference to those communities in Bournemouth, Christchurch and Poole? Again, so our proposed areas of focus from the workshop that we held in February are around ageing better. We've already had that conversation. It's come up again today in the conversations we've had. Listening better, thinking about listening broadly and listening deeply. So where we need to do those deeper dives on particular focuses, that's what we do. Food insecurity, it's impacting on every single one of our organisations through our staff and our communities. Let's make it a priority. And at the last Health and Wellbeing Board, we agreed that we would have a whole system approach to adopting the Poverty Truth Network values. And let's think about some golden threads. I want to keep this really simple, but really meaningful. So it's about using those strength-based approaches. Again, organisations like CAN, about how they support our community and voluntary sector. Working with our community and voluntary sector on an even plane, making sure they're respected and valued and involved in all our work, which I know all of you do. Thinking differently. So think about culture, libraries, holistic wellbeing and the role that that actually plays in terms of health and wellbeing. And I'm banning any use of acronyms across the place-based partnership. So that is all I had to talk to you about today. My proposal are in terms of next steps that we undertake a mapping exercise around those subjects to really get a clear understanding of what's going on. There's so much work taking place. We want to make the best use of our resources and really target where we can to make a real difference. We want to convene a really strong organisation of partners coming together across the system to really focus on that jam, that Nutella, whatever you want to call it. It might be Marmite for you, I don't know. Whatever is your individual cake flavour that sits in the middle that can add the real benefit to our communities. So you can tell me you don't like it, that's fine. This is what I'm proposing is how we take this forward in terms of a place-based partnership within Bournemouth, Christchurch and Poole. And I'd just like to open it up for a further conversation and discussion. I'm not going to give you an action plan with 28 pages. I'm going to give you let's start with people. Let's start with a plan on a page. Let's grow it. Let's mould it. Let's work with our community and voluntary sector to really understand what it needs to look like on top of that cake layer of our statutory functions. And let's take it forward.
Okay. Thank you very much for that, Kat. That's, I think, got people thinking in the room by the looks of it. Zena, did you want to?
Thanks, Kat. That was really, really interesting. Just two points. One is relates back to obviously the BCF, and I really feel Falls fits so lovely in this and the whole mapping and everything else, because even on reflection, there's so many areas we're not even counting in the Falls work around our care tech and our lifeline and everything else. So that mapping, I think, going back to basics, starting the mapping, it would be a great starting point, and it would be a great place to start on that. And the second bit is in adult social care commissioning, we have just in the process of starting a co-production board and writing a strategy, so it's in draft. So I really need to link with you to make sure that we're not duplicating and having all these co-production groups everywhere else saturate our people with lived experience. So maybe we could do some joined up working on that.
Definitely. Thank you, Zena.
Thank you. Kathy, did you want to?
Thank you very much, Kat. I would say it's a huge array of cakes that you're probably looking at, and none of them are the same size, shape, form, or function. And so the tasks that we're talking about here, or the objectives, are really, really difficult to kind of hone down in. And I feel there's a sense that we have been wandering around the challenges around integrated neighbourhoods for some time without enabling some landing somewhere. And some of the work that I think we've done previously, it feels as though that we've moved some of what are the things that we're going to concentrate on, or what are we not going to concentrate, and they have slightly changed. And I think that there does need to be an action plan which is about how we understand what it is we're going to deliver. And we cannot combine all the cakes together at once, but what are the few cakes that we're going to do to begin with to enable us to get a structure and a form to do the next bit and the next bit. And I absolutely think your call to action about who's going to help and lead on this is absolutely vital, because it cannot sit just with you and or the council. It needs to be across the board, and so I'm just a little bit nervous that we're in danger of planning to plan again, and so I just think we need to think about what is the help and support that's needed to actually get into a delivery mode of at least the landscape and understanding the landscape. So appreciate this is not easy, absolutely 100%, but how we can as the board facilitate that ownership and support to engender what it is that we are actually going to do.
Betty, do you want to?
Yeah, thanks, Kat. And I've seen this before with you, and we've had a conversation around some of the points, particularly picking up on the strengths-based and conversational approach. You know that we've talked about this and how this is our Fulfilled Lives programme, transformation programme over the next few years that we're building on in adult social care. So really, really keen that we're right in there with all of this. So I'm not going to rehearse what you and I've already talked about, but just to say that there is work that we will be doing together, and Kat's going to be in reaching into adults via some of our forums that we have within our management team. Kat, I guess what I just wanted to say really is that I really support a mapping exercise where you really get into what are we going to be doing it over this period of time, and then what are we going to be doing over another period of time. A bit like what Kathy touched on. You can't do everything at once, but we will have several things that we need to do. But it's about, you know, mapping that out and putting the timeline by it and a priority by it. Is it the first thing we do? Is it the third thing we do? And then just finally for me, of course, really echo and support the putting people at the heart of it, and that's where you start from, and then you build around that. So love this, really keen to be involved in it and make sure the right people are involved in it from our areas. But yeah, that's really what I want to say. Thanks, Kath. Thank you.
Thank you. Other comments or feedback? Mark, did you want to? Oh, Kat. Sorry, Kat, did you want to come back?
Thank you. No, just really value the comments there, and sort of what I'm proposing is that if it'd be all right with you, Chair, I know we discussed it before, but maybe we come back and we do a brief update at each Health and Wellbeing Board on the progress and those conversations that Betty's just mentioned about what do we prioritise, because we do have limited resources. That would be something that the board could basically choose, you know, and say actually you can't do all of them. You spread your Marmite, spread your jam too thin if you try and do all of these, but where we could really bring value would be around this one particular item or these two particular items, and then for the board to make that decision and to encourage us to take that item forward.
Okay, thank you. Mark, did you want to?
Yeah, thanks. And completely support everything that Kat said. And I love the analogies around the jam, Marmite, or whatever your fancy is. I guess really there is something for me, as it's just been said, around actually really thinking about the impact on people's lives for this. And actually this is our opportunity to start thinking about the outcomes. And tying it back into this forum is around, you know, if you think about the health and wellbeing strategy, for me, the stuff that Kat's just sort of outlined, if we can really get down and understand that sort of stock take or sort of analysis and sort of hone down on one or two priorities to think about what it is we're actually going to deliver. So picking up your point, Kathy, around sort of making sure there's delivery in this is going to be critical. We don't want it to become just a sort of a forum where people come and talk and update. It's actually thinking about how do we make a real difference to people on the ground. And I suppose there is something around the health and equality aspect for this that we probably just really need to make sure we keep at the forefront of our mind. That actually, as we do this work and stock take, we need to really get down and understand what communities are telling us, what those inequalities are, and then how do we as a group respond to that. And it may mean that we've got things going on at the moment that are not addressing that. And I think we need to be brave and honest enough for ourselves to sort of say, hang on, we haven't got this right. We might need to change. And that's not, you know, and that will help us with the duplication piece as well. Thank you. But thanks, Kath. Fully supported. Okay.
Thanks for that. Any other comments, particularly Gillian?
Yeah, I think when we embarked on this piece around strategy to action, sort of coming on for 18 months ago, when we as Health and Wellbeing Board had a workshop around it, and we started talking about place-based partnership. We've kept testing ourselves on whether what we really need in our system is another piece of governance, and we've questioned ourselves about that, because we've said, well, we have a lot of system meetings already. We meet together a lot already, so let's really be sure before we put another bit of governance together. What was really interesting in our February workshop was actually how many people came to the table and came together because they wanted to share their experiences, learn from others, and just that sense that they weren't coming along to a talking shop, but actually there was a sense that there was that need. And I think what's different about the emerging place-based partnership is it doesn't need to be at that sort of corporate board level. It is about bringing people together to actually get on and take some work forward to get into that delivery space, so that when Health and Wellbeing Board comes back together once every couple of months, we can feel that some action's taking place in between times. it's not trying to step into the individual projects and programs that are going on, but it's gathering a sense from people about what difference those are making, using data, but also using lived experience, and asking the so what question of what this all adds up to. One of the differences from the place-based partnership and other bits of governance that we have around the system is it brings together health and care partners in the broadest sense of the word, on a BCP footprint, not on a Pan Dorset footprint. And there's a lot going on nationally in our health and care systems at the moment, and we heard the Secretary of State for Health saying more today, didn't we, about where he sees things going in terms of social care. I can't predict the future. I know there's lots more change to come for our system, but I have a hunch that place is going to be really important as part of that future. So I would encourage everyone around the board and those who showed up for that place-based partnership piece to continue to trust in it and work with it, and work with that process to see if we can use it to make a difference. I think it's something that is growing and in strength, and thank you to Kat for bringing it together. I love Kat's presentations, but I always leave them feeling hungry. It's all the talk about cake. So thank you, Kat.
Thank you for that. Any other comments? I was just thinking, I was trying to, using your cake analogy, work out whether we're thinking about a cake or whether we're actually thinking about walking into a cake shop and there's all different cakes there, and we just decide for this time we're just going to try and eat the fondant fancy and the bread pudding, and then we'll come back later and eat look at the shoe buns later on. But yeah, I think there's a bit of value. You said something about maybe we sort of have it ongoing meetings to sort of I suppose it's for the Health and Wellbeing Board, for me to have a sort of watching brief and to sort of question things and ask that so what question. So maybe we do need to have something on each of our agendas to just sort of understand where place-based partnership working is going, and actually question that and make sure that we're happy that things are moving, or make sure that the right sort of partnerships are and the right links are being made. But it is, yeah, I think from what Kathy said as well, it's that and Mark as well, it's about the action and the delivery and making sure that we are actually going to eat the fondant fancy and deal with that, or whatever it is. Yeah. Kat, I don't know if you want to sort of sum up what your thoughts are about what to come back with at a future meeting. I'm aware we haven't sort of drawn up a sort of 2-3 page strategy. This is what the Health and Wellbeing Board are delivering as a strategy, and I think of all the various meetings we've thought, well, that's not really what we wanted, because we've got the integrated care partnership strategy which we're aligning our work with. It's if people are happy that we have a sort of watching brief and have regular sort of updates on it to make sure that we're actually that those of us that are meeting here are actually inputting to make sure that the whole system's going in the right direction, actually actions are happening and people's lives are being affected. I like where you talked about starting with the person as well.
Thank you, Chair. What I suppose I'm looking for from the Health and Wellbeing Board is basically, are they supportive that we take this forward as our proposal for how we develop the the place-based partnership going forward? I'm not hearing any general dissent that this isn't what we should be doing, and I would be happy to come back, whether you would want that as a formal report or whether that's a sort of a verbal update at each Health and Wellbeing Board meeting, and then we can see if it's working, and if it's not working, well then we can shift and change and potentially do something different. But it feels like we sort of need to move forward now from probably talking quite a bit about what we want to do and move into that delivery and action plan. And I don't want to over engineer a system. I'd rather we just convened partners together and see where those, as we talked about that mapping, where are those gaps, where do we think we can bring the extra benefits, and then move that forward into real outcomes for people within Bournemouth, Christchurch and Poole.
And just thinking about actions, it's one of those, the sort of mapping work, just in terms of how that would happen, who would be involved in that? Is that a case of sort of workshop work to sort of to map that?
That's my thinking. We've got quite a bit of that mapping that's already been done through various different avenues. So the Early Help Service have done a lot of that work already through their family hub work. Community Safety Partnership Board have done a lot of that work already. I'm sure adults have done a lot of that work already. So we're bringing together that work, and then just this sense checking. Is there anything that's going on that we don't know about? Are there things that are happening that we need to make sure are reflected? I think it'd be valuable work for everyone to have that really good oversight of what's going on across the system, whether that's within the council, whether it's in the health services, or with the wider community and voluntary sector partners. But I think we would initially do that desk-based. What have we got? What do we know already? Bring it all together. Then look at holding a workshop with those who would be interested to sense checking that, making sure it's appropriate, and then bringing that forward. That's probably the first output that we would bring forward to the Health and Wellbeing Board, along with some proposals about where we think there might be gaps or where we think we can bring added value.
Okay, thanks. Yeah, I like the sound of that. Is everybody okay with that? Got a few sort of nodding heads and people seem in agreement. Okay, thank you very much for that, Kat. That's useful in helping to sort of direct our sort of thinking and where we're going. And thank you for that. Right, I think that was all we were asked on that one, was to discuss the outcomes from the workshops, wasn't it? And approve those recommendations that and commit to playing an active role through our representation of the place-based partnership. So, okay, that's everything on that. The next item is item 10, our work plan, which has been circulated in advance. Any comments or input? Obviously, the next meeting is on the 9th of June. The Children and Young People's Partnership Plan is scheduled there. I think we should probably then schedule at least something for a verbal update, or whether it would be a verbal update or written report on where we're going with our sort of health and wellbeing strategy into action, place-based partnership work. And I'm happy for it to be either a verbal update or a written report, regardless of, sort of depending on what progress has been made and what there is to actually, whether there are recommendations that actually need to be sort of tabled and moved through. Any other comments on the action plan? I know at the next meeting, I'm not sure whether it's in the next meeting or future meeting, about public health changes. Certainly had the conversation this morning, because from next week we've got a new Director of Public Health and Communities for BCP, as BCP Council's first Director of Public Health, starting with us, and I'm sure he'll be wanting to, Rob will be wanting to have input to sort of what's on our agenda and what we're considering, and be an active part of the Health and Wellbeing Board. So I've got a sense that actually something, probably at the next meeting, maybe before when Rob started, if he wants to sort of have some time to sort of talk about where he is and where public health are, and how he's sort of shaping what public health is going to be doing within BCP. I'm sure we can make time available, whether it's for that one or the following one, but I think that would be really useful for us all. Any other comments about future agenda items or our work plan? Yep, Rachel.
And I'm sure Rob would, but I won't. Don't get the message back that I've set him some work. But yeah, no, absolutely. But thinking about picking up on the discussion about the plan for the Better Care Fund and that prospective, because it feels like with the Children and Young People's Partnership Plan and bringing that, and then the proactive work on the Better Care Fund, feels like they're two really significant opportunities, looking at two key parts of our population, and with the framing of how we approach it, with the really great presentation by Kat, that feels like that's a really solid piece of work, thinking about the agendas for the next one.
Yeah, because we'll obviously have, you'll be back, Scott, at the next one meeting as well. So. Okay, Graham, did you want to comment?
Yeah, thanks, David. Not really an item for the forward plan, but I just thought we should record our thanks to the public health team for the last 6 years as BCP Council, and been a few ups and downs, been the odd minor global pandemic sort of got in the way of things, and I just wanted to pay tribute to the work they've done because it has been really, really good. The future arrangement is by no means a reflection on the performance of the existing team. It's just a new arrangement for BCP Council, but I think we should formally record our thanks to the whole of the public health team for the work they've done across BCP and Dorset up to date. And can they keep it going for another week, please?
Yeah. No, thanks for that, Graham. And I think I think we probably all agree with that. And something, the conversation we were having this morning that I'd like to see in future agenda items, actually keeping it public health actually coming back to us and making sure that actually those structural changes aren't just, got a different way of working, but actually it's starting to deliver on what we're all hoping it's going to in terms of the sort of the BCP BCP footprint. So I think that's going to be something quite important for us as Health and Wellbeing Board to assure ourselves that those changes have been worthwhile and are actually sort of delivering for our own population in BCP. So other than that, not so much on the work plan, but actually I'd also like to thank Gillian. It should be your last Health and Wellbeing Board before you move on. So when you were saying for the last 6 years, I thought Gillian's only been here 6 years. But yeah, thank you for your input and involvement over the last sort of year or two in terms of helping our thinking on the Health and Wellbeing Board and actually being more effective. And I know it's much more wider than that on integrated care partnership and everything. So thank you for everything. Good luck with moving on to your next place and dealing with their health and wellbeing issues and much broader issues at Southampton. So thank you.
Thank you, David. Although you might expect me to say this, I think health and wellbeing issues are all the issues at the end of the day. If we bring the right focus to health and wellbeing, the rest will follow, and I will be looking on to how you do things here in BCP with real interest. But thank you.
Thank you very much. Okay, unless there's any other points. Oh, yes, did you want to, Sarah?
It was only, I think Siobhan would kill me if I didn't mention it, because you've probably been aware of a huge impact on health and wellbeing is the huge changes that we're doing within the system. We're going live. So actually tomorrow is our first major service that actually moves into the beach with critical care moving. But the big one, which has a wider impact on the system, is maternity and neonates. That moves next Monday. So I suppose it was just as a highlight for everybody that we've been all talking about it for years and years, and it's been in conversation. But actually we're in a place where actually that is happening and that reconfiguration is going live. So just to raise it and flag it for everybody.
Thanks for that, Sarah. And that's something certainly I've sort of talked about in a number of different forums that we speak about in integrated care partnership. Even last week at the Adult Safeguarding Board, we talked about those sort of changes actually coming to life over the next year, 18 months or so. And it has so many sort of all different parts of the system need to have that within their thinking about whether it be from an adult safeguarding point of view or future care or all sorts of areas. So yeah, I think they're really important changes, and hopefully, well, I'm sure there will be real sort of physical embodiments of actually improved services for local populations. So thank you for that. Right, okay, if that's everything, now we'll close the meeting now. Thank you.
Thank you.